Medicine is an ocean of which what we know is just a drop. A quote one of my favorite professors, Dr. Sujit Raina, has told me during my residency days. Welcome back to the Superdoc Insights, where we explore the deeper layers of health, personal growth, and challenges we face as doctors. Today, I want to take you on a journey through something that came to me during meditation. It's an idea that's been forming in my mind for a while now. That the diseases we treat are often symptoms of something much more deeper. We are trained to treat the physical body. But what if the real root of the disease lies beyond that? Every textbook we open in medicine defines health as a complete state of physical, mental, emotional, and spiritual well being. But as doctors, what do we really focus on? We focus on the physical aspect, and that too, just symptom management mostly. It's not that the drugs we prescribe don't work, they work wonders, trust me, especially in critical care medicine where they can be life saving. But are we missing something by not addressing the root causes? Today, we are going to explore this question using the 5 whys technique. It's a simple but a powerful technique to dig deeper into the root causes of a disease, both for our patients and for ourselves. Because let's face it, how many of us really take the time to address our own health? Let's start with how health is defined in medical textbooks. We all know the definition: health is a state of complete physical, mental, emotional, and spiritual well being. But how often do we actually apply this definition in practice? More often than not, we are stuck in the cycle of symptom management. We treat the disease as it presents itself: cholesterol levels, blood pressure, sugar levels, and we move on to the next case. It is a good way to deal with these things. There's nothing wrong for something I've been practicing for the past 6 years. I know it works. But what if there's something deeper? I started realizing there's a gap as I delved deeper into critical care medicine. Western medicine is brilliant at acute care, emergency management, and all the life saving interventions it has given us. But when it comes to management of chronic diseases, preventive therapy, or even autoimmune conditions, we often just scratch the surface. We treat the immediate physical symptoms. But what about the underlying mental, emotional, and spiritual imbalances? As doctors, we see patients struggling with diseases like diabetes, coronary artery disease, and hypertension. We prescribe medications, offer lifestyle advice, and send them on their way. But are we really addressing the root cause? This is where the 5 whys technique comes in. This is a technique taught to me by one of my mentor, Thaddeus Lawrence, for personal introspection. And suddenly it hit me, why don't I just apply this for symptom analysis? I want to share an example of how this works in practice. Let's take an example of coronary artery disease. Why does the patient have CAD? Risk factors like cholesterol, uncontrolled sugars, etc. Why do they have cholesterol and uncontrolled sugars? Because of unhealthy habits and a lack of exercise. Why do they have unhealthy eating habits and don't exercise? Because they are too busy, stressed, or don't have enough time to manage their health. Why are they too busy or stressed? Maybe they have unresolved mental blocks, emotional baggages, or limiting beliefs that stop them from prioritizing their health. Why do they have these mental blocks or limiting beliefs? This is the deep trigger, the point where they started spiraling down this path. It could be related to a childhood experience, a trauma, or simply being overwhelmed by the pace of life. And here's the thing, if we just treat the cholesterol and sugar levels, we are treating the symptom. But if we dig deeper, if we can help the patient address the root causes, the emotional, mental, and even spiritual blocks, we can help them heal in a much more holistic way. I want to share a personal story here because this realization didn't come easily to me either. As I progressed in my medical career, diving deeper into scientific facts and learning the ropes of critical care medicine, I began to lose touch with spirituality. It wasn't a conscious decision. I was just too absorbed in the world of medicine that I neglected that aspect of myself. I stopped going to temples, stopped engaging in spiritual practices, and thought that science was all I needed. But as I started treating patients in the ICU and seeing the emotional and the mental toll diseases take, not just on the patient but on their families, I realized there was a gap in how we treat people. It wasn't just about the physical care. I needed to find a way to ground myself again, to stay centered and aligned with my purpose. In fact, I believe that India's deep rooted spiritual practices, whether through temple visits, yoga, or meditation, are designed to keep us aligned and centered. It's not just about the religious aspect, it's about the process that keeps us grounded. I started reflecting on the definition of health: physical, mental, emotional, and spiritual well being. And I realized that I had been neglecting three of those aspects. Yes, I was physically fit. Yes, I was gaining knowledge. But I wasn't taking care of my emotional or spiritual health. This realization brought me back to balance. I started meditating again. I started taking time for things that made me feel alive, whether it was a workout, spending time with family, or simply taking a moment to pause. And what I found was this: when I started working on just one of these aspects, the others slowly began to align. Physical health started improving my mental clarity. Emotional awareness started making me feel more centered spiritually. It's all connected. So, my advice to you is this: if going to a temple makes you feel better, do it. If working out clears your mind, make time for it. If meditating helps you align with your purpose, don't neglect it. Start with one thing, and the rest will follow. As doctors, we have a responsibility to not only treat our patients but also to take care of ourselves. We can't pour from an empty cup. If we want to give the best care, we need to be the best version of ourselves. This is what I call the Midas touch. It's the alignment of the physical, mental, emotional, and the spiritual health. When we are aligned, the medicine we prescribe, the care we give, it carries a different energy. It's more than just a job, it's healing with a purpose. Imagine giving a medication with the intention of truly healing the patient rather than just checking off a box on your to do list. That energy transfers to that patient. And that's the difference between treating a disease and healing a person. Before we close, I want to leave you with a few questions for reflection. These are the five whys for you to ask yourself. Why do I feel fatigued or overwhelmed? Why am I not addressing my own health? Why am I procrastinating or feeling stuck? Why am I not prioritizing my mental or emotional well being? Why am I not aligned with my true purpose? Take a moment to reflect on these questions and don't rush the answers. It's a slow process. But the more aware we become of our blocks, the more we can take action to realign ourselves. The next time you are treating a patient, don't just stop at the physical symptoms. Ask yourself the five whys. What's beneath this surface? What's really going on? And most importantly, ask the same of yourself. We might not get all the answers at once, but it's a process that leads to true healing. Remember, medicine is an ocean of which what we know is just a drop. Let's not stop at that drop. Let's dive deeper. Thank you for tuning in to the SuperDoc Insights. Stay aligned, stay aware, and keep striving to be the best version of yourself because that's how we give the best to our patients. Until next time, take care.